In a tranquil setting, a solitary figure sits by the window, lost in thought, reflecting a silent struggle depression. Depression, a prevalent mental illness, casts a long shadow, often unnoticed and misunderstood. Its impact is profound, affecting individuals, families, and communities globally. This exploration aims to shed light on depression's multifaceted nature, delving into its historical context, diverse forms, and subtle signs. By fostering understanding, we can break down barriers and encourage support. Our journey begins by acknowledging the hidden burden of depression, affecting individuals from all walks of life. We'll delve into the history of depression, tracing its roots from ancient civilizations to modern medicine. This exploration reveals how perceptions of depression have evolved, shaping our current understanding and treatment. We'll explore various forms of depression, each with unique characteristics and challenges. This journey equips you to recognize the subtle signs of depression, empowering you to seek help. Understanding depression stretches back to ancient civilizations. The Greeks documented melancholia, believing it stemmed from an excess of black bile. Hippocrates linked mental states to the physical body, laying the foundation for a naturalistic approach to mental health. This shift away from spiritual explanations paved the way for centuries of inquiry into the mind-body connection. The Greeks' efforts marked a significant shift in understanding mental distress. The humoral theory influenced medical thought for centuries, attributing melancholia to bodily imbalances. Treatments varied from bloodletting to herbal remedies aiming to restore balance. Religious beliefs also shaped perceptions, viewing melancholia as a spiritual affliction. The Renaissance saw thinkers challenge the humoral model, exploring alternative explanations. The Enlightenment spurred systematic study of mental phenomena, recognizing melancholia's complexities. The 19th century marked a turning point, laying the groundwork for modern depression concepts. Advances in neurology and psychiatry highlighted the brain's role in emotional regulation. Emil Kraepelin's work established a systematic approach to mental illness classification. The 20th century saw an explosion of research and treatment advancements, including psychopharmacology. Medications and psychotherapy remain crucial components of comprehensive care. Major depressive disorder is the most prevalent and severe form of depression. It's characterized by pervasive sadness, loss of interest, and physical symptoms like sleep disturbances and fatigue. Cognitive function suffers, making concentration and decision-making difficult. This cognitive fog isolates individuals, affecting work, studies, and relationships. The world may appear distorted and difficult to navigate. Persistent depressive disorder or dysthymia is a chronic, low-grade depression lasting years. Symptoms are subtler but equally debilitating, making life feel like an uphill battle. Individuals may accept this chronic low mood as part of their personality, hindering recognition of the need for help. With appropriate treatment, individuals can manage symptoms and rediscover joy. The journey requires patience, but reclaiming emotional well-being is rewarding. Bipolar disorder encompasses periods of mania and depression, creating emotional highs and lows. Manic episodes involve inflated self-importance, racing thoughts, and risky behaviors. Depressive episodes mirror major depression with profound sadness and loss of interest. Managing bipolar disorder requires medication, therapy, and lifestyle changes. Mood stabilizers, therapy, and healthy habits promote stability and well-being. Depression varies widely, with subtypes like postpartum depression and seasonal affective disorder. Postpartum depression affects some women after childbirth, with symptoms mirroring major depression. Seasonal affective disorder occurs during specific times of the year, often due to reduced sunlight. Depression can also result from medical conditions or substance use. Understanding these diverse forms is crucial for accurate diagnosis and tailored treatment. Recognizing depression's subtle signs requires attentiveness and understanding. Persistent sadness, emotional flatness, and loss of interest signal something is amiss. This emotional withdrawal affects relationships, making connection difficult. Individuals may isolate themselves, feeling numb and detached. Recognizing these signs is the first step towards seeking help and support. The emotional landscape of depression is often characterized by a pervasive sense of hopelessness and despair. Imagine a heavy fog settling over one's mind, obscuring any glimmer of light or possibility. The future may now appear bleak and uncertain, shrouded in pessimism. Goals once pursued with vigor may now feel unattainable, replaced by futility. Negative thoughts may take up residence, whispering insidious doubts and self-criticisms. Self-worth plummets, replaced by feelings of inadequacy, guilt and shame. Past mistakes may now loom large, casting long shadows of regret and self-recrimination. The inner critic may now transform into a relentless tormentor, amplifying every perceived flaw. This negative self-talk can become all-consuming, eroding self-esteem and leaving individuals feeling trapped. The ability to silence these negative thoughts may diminish, and even the most well-intentioned words of encouragement from loved ones may fall on deaf ears. The weight of these negative thoughts can feel crushing, making it challenging to engage in positive self-reflection or to envision a brighter future. In some cases, these negative thought patterns may escalate to include thoughts of death or suicide. These thoughts, while deeply distressing, are often a symptom of the illness itself, a sign that the brain's normal functioning has been disrupted. It's crucial to remember that these thoughts are not a sign of weakness or a character flaw, but rather a cry for help, a desperate plea for relief from the overwhelming pain of depression. If you or someone you love is experiencing thoughts of suicide, it's imperative to seek immediate professional help. Depression impacts both mind and body, manifesting in physical symptoms like fatigue and sleep disturbances. Recognizing these signs is crucial for seeking help. Fatigue can make simple tasks feel monumental. Sleep issues like insomnia or hypersomnia worsen the cycle. Appetite changes also signal distress. Recognizing the signs of depression in yourself or someone you care about is a crucial first step toward seeking help and embarking on the path to recovery. However, knowing when to reach out for professional support can be challenging, as individuals often downplay their symptoms, attributing them to stress, fatigue, or other external factors. It's important to remember that depression is a real illness, not a sign of weakness or a character flaw, and seeking help is a sign of strength and self-awareness. If you've been experiencing any of the symptoms of depression for 2 weeks or more, or if these symptoms are interfering with your daily life, it's essential to reach out to a healthcare professional. Don't wait for the situation to worsen or for the symptoms to magically disappear on their own. Early intervention is key to successful treatment and recovery. Your primary care physician is a good starting point. They can rule out any underlying medical conditions that may be contributing to your symptoms and can provide referrals to mental health professionals, such as therapists, psychologists, or psychiatrists. These professionals are trained to diagnose and treat mental health conditions, including depression, using a variety of evidence-based approaches. Remember, you don't have to navigate this journey alone. Reaching out for help is a sign of courage and self-compassion. With the right support and treatment, you can overcome the challenges of depression and reclaim your life. In a society that often prizes resilience, it's easy to underestimate the impact of depression. Well-meaning friends may offer platitudes like "snap out of it" or "look on the bright side." These can trivialize the real experience of depression. Dismissing depression perpetuates silence and shame. It can prevent seeking help, worsening symptoms. Untreated depression affects relationships and work. It's crucial to approach mental health seriously. One of the challenges in addressing depression lies in its often invisible nature. Unlike physical illnesses that may manifest with visible symptoms, depression often lurks beneath the surface, its presence revealed through subtle shifts in mood, behavior, and cognition. This invisibility can make it difficult for others to fully grasp the extent of an individual's suffering, leading to misunderstandings and a lack of empathy. Imagine, for a moment, trying to explain the sensation of a migraine to someone who has never experienced one. You might describe the throbbing pain, the sensitivity to light and sound, the nausea, but words alone can never fully convey the intensity and all-encompassing nature of a migraine headache. Similarly, trying to articulate the depths of depression to someone who has never experienced it can feel like trying to describe the color blue to someone who has been blind since birth. This disconnect between the internal experience of depression and its often subtle outward manifestations can lead to feelings of isolation and loneliness. Individuals struggling with depression may feel like they're living a double life, putting on a brave face for the outside world while battling a relentless storm of emotions within. This constant effort to mask their true feelings can be emotionally exhausting, further depleting their already limited energy reserves. Unmasking the invisible illness of depression requires open and honest conversations about mental health. By sharing our stories, challenging stigmas, and educating ourselves and others about the realities of depression, we can create a more supportive and understanding environment where individuals feel safe seeking help without fear of judgment or shame. Breaking free from the grip of depression often requires a two-pronged approach, reaching out for professional help and reaching in to cultivate self-compassion and support. Seeking professional help is not a sign of weakness, but rather an act of courage and a commitment to prioritizing one's well-being. Just as we wouldn't hesitate to consult a doctor for a physical ailment, we must approach mental health with the same level of diligence and seek guidance from qualified professionals. Therapists, psychologists, psychiatrists, and other mental health professionals are trained to diagnose and treat mental health conditions, including depression. They can provide a safe and confidential space to explore the root causes of depression, develop coping mechanisms, challenge negative thought patterns, and work towards lasting recovery. Therapy can take many forms, including individual therapy, group therapy, family therapy, and cognitive behavioral therapy, among others. In addition to seeking professional help, it's equally important to cultivate self-compassion and engage in self-care practices that nurture both the mind and body. This may include activities such as mindfulness meditation, yoga, spending time in nature, engaging in hobbies that bring joy, journaling, listening to uplifting music, or connecting with supportive friends and family members. Remember, recovery from depression is a journey, not a destination. There will be good days and bad days, moments of hope and moments of despair. Be patient with yourself, practice self-compassion, and celebrate every small victory along the way. With the right support and a commitment to self-care, you can emerge from the darkness of depression stronger, more resilient, and more connected to yourself and the world around you. Our exploration of depression reveals a complex condition touching countless lives. Depression is not a life sentence, it's treatable. Seeking help is an act of courage. You are not alone. Break the silence, shine a light, reach out, share your story, embrace your strength, honor your journey. Let us carry forward a message of hope. Subscribe to the channel and watch more interesting videos. Thank you